Hi guys. So I'm all hooked up, starting chemo. The nurses and staff are very nice and kind and professional. Um, Talked to the dietitian and went over some of the main changes I've had in my food that I don't, I'm pretty much vegetarian now, but I still do eggs. Sorry, I'm always biting my lip. But right now I just have a slight warmth feeling. I've been hooked up for about 10 minutes. And I feel like I smell just normal. No metallic taste right now. They give you stuff to combat any nausea or anything, but I've been snacking anyways. I don't want to overdo it in drinking, but yeah, I'm getting hungry because I didn't really eat a good breakfast. Whereas yesterday, when I thought I was going to get treatment, I made sure I had like an omelet and a sandwich and stuff, ate heavier, and then I packed my food for here. So I actually drove myself because a lot of things changed into a place yesterday where it'd be harder. My mom is going to take over the care of my children while my husband leaves for work. And I don't really want her dragging all the kids out. It's hard enough with, watching them, but pretty much three. So I live about 10 minutes, 10, 15 minutes away from the not even 15, like 10 minutes away from the hospital drive-wise. So I would just take my time. And then when I get home, dinner's pretty much done, and I'll rest a little bit. So I'm going to do my best to keep my energy up. I did talk about the dietitian that green smoothies, play a big factor, even more so shortly. So with the change in diet, because I do want a good cell turnover. So I have a better, chance. This is going to pummel my red blood cell count and white blood cell count. So the medicines that I'll be getting will actually help boost them, but that means my long bones are going to be in overdrive, making me feel weaker until they come up and count. So I can be anemic for a while. So I want to, keep that up there. But anyhow, I will come back later on and let you know how I fared after it's done or when I'm home and settled, and I will talk to you later. Okay? And here's the port. I have a port placement. I'm all hooked up. It's covered and running attached to my medicine up there. But if there's any questions anybody has, let me know, or questions you think that maybe I have not asked to inquire about. I did get to see my scan this morning. And frankly, because I'm not really trained in ultrasound or scan, my eyes aren't really keen to pick up stuff. The only thing that I really noticed on my PET scan was, for the breast area, I couldn't see anything different. It just looked slightly enlarged from my non-nursing breast to the one that has the tumor or mess up in it, and the lymph node possibly behind, but I couldn't actually see any definition of anything except it was slightly larger. And actually the nurse practitioner was like, oh, well, here it is. And I'm like, isn't that the pleural space, which would be the lungs? She's like, oh, yeah, you're right. I don't think she's really that trained at it. That's why you deal with radiology there. They're very trained. It takes years to really master it. So that's what it is. But yeah, I really couldn't see a difference on the scans and notice much more. So anyhow, I will get back to you later on. It is 10:14 now. I'm looking to be here possibly 4.5, 5 hours. And then later on, if I feel up to it, I will update you to that, okay? I will talk to you later. Have a good day. Bye.